Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, and today we're going to talk about the American Heart Association's 7 Heart Healthy Habits. In today's day and age, nothing could be more important than taking care of ourselves. I've said before that if we could snap our fingers and get rid of something as simple as obesity, then something like COVID wouldn't even exist. We'd have very small percentage of people. The other thing we hear is, oh, well, this person was healthy and they got COVID and they survived, but they didn't do well. I got news for you. What we consider healthy is generally not healthy. So today I'm going to go over what the American Heart Association considers the 7 heart healthy factors, and I will tell you that this is a very low bar. As we go through this, I'll kind of cover what I would consider far more important factors to look at. But even with this low bar, less than 1% of the freaking population meets these factors. They're not hard, but less than 1% of the population meets them. On the flip side, 39% of the population thinks they're heart healthy. Well, guess what? If you don't meet these factors, you're not considered heart healthy. So something to consider. And as we go through these, get out a little checkbox and mark off whichever one you have or don't have, and feel free to add in the comments how many you do or don't have. And if you meet all 7, then by all means speak up, because that population is very small. I actually said less than 1%. Adults, generally 0.3%, meet heart healthy criteria. So number 1 is being a non-smoker. That seems pretty obvious, pretty cut and dry. You're either a smoker or not a smoker. I would put vaping on this list as well. Vaping is not probably as immediately dangerous for the heart, but if you're a vapor, you can't consider yourself healthy. You're just being exposed to too many chemicals to consider that. Number 2, BMI less than 25. Now, I hate body mass index, that's height versus weight. I hate that as a marker because if you happen to be a gym rat and really well and buff, your BMI is going to come higher. I like waist to hip ratio. So if you haven't seen your toes in a decade, your waist to hip ratio is not what it should be. That you can figure that out. If you look at somebody and their waist is bigger than their hips, then it's an issue. And it's a sign of abdominal obesity, which is not the type of obesity we want. So while the American Heart Association considers BMI as the important factor, it's really not. It's waist to hip ratio, or even better, body composition, looking at something like your actual body fat markers. Number 3, physical activity. Moderate exercise, at least 150 minutes per week. Vigorous exercise, at least 75 minutes per week. Anybody who's followed me for any knows I'm not a fan of our typical exercise recommendations. I think that short bursts generally has better data for protecting our heart. It constantly challenges our heart. I've got some videos out there on how I exercise and how I use the elliptical in the martial arts, things like kickboxing, jiu-jitsu that I've done. Those are all, most of our sports are all short bursts. So if you're walking 20 minutes a day, which is 150 minutes per week, and it's a vigorous walking, I would still suggest that's not enough. I have patients my age who are just walking for exercise, and quite frankly, it's not enough. If all I was doing was walking at my age, I would consider myself not doing what I'm supposed to be doing for my overall health. I remain a big fan of short burst exercise. I continually push myself, and sometimes I even cheat. And I usually recommend 30-second bursts with rest time. For me, it just depends on what I'm watching on Netflix. But sometimes I cheat and stop at 29 seconds because what I'm doing is so intense that I really can't do it for 35 or 40, 45, 50 seconds or a minute. Fourth factor. Fourth factor is a healthy diet score, having at least 4 to 5 elements of a healthy diet score. And I will tell you that the American Heart Association's idea of a healthy diet is not necessarily my idea of a healthy diet. It's easy enough to find, but this is a very low metric to meet. Basically, if you're not eating crap, you probably meet the markers of a healthy diet, I would get far more specific as what constitutes a healthy diet score. But even at that low level of a healthy diet score, we fail as American citizens for marking that. Cholesterol less than 200. For those of you, or for those of you that heard that high cholesterol doesn't matter, and a lot of people on keto promote this, that's not true. Cholesterol, don't be mistaken, taking a med to lower cholesterol is really what they're talking about, but having a lower cholesterol is a good sign of you living your lifestyle for your genetics. So lower cholesterol is good. That also goes with another factor, which is fasting blood sugar less than 100. You find that fasting blood sugar and cholesterol, especially HDL and triglycerides, go hand in hand. So the healthier we are, those numbers will both go low. So those are good markers to have in general. Fasting blood sugar, if you're not medicated, lower is better. Another factor is blood pressure, less than 120 over 80. But by the way, cholesterol and blood pressure includes non-medicated. So if you think you're in the less than 1%, but you're taking a statin and you're taking high blood pressure medication, you are not in the 1%. So again, 0.3% depending upon your age, but blood pressure, cholesterol, and fasting blood sugar are all very highly tied to being pre-diabetic. So those are the 7 factors. I think I covered them all. Again, in the comments, if you think that you fit them, then go ahead and put yourself in there. The vast majority of people don't. So when we hear, oh, so-and-so got sick and they were healthy, in our country, healthy means you don't actually have a diagnosis. So the idea that somebody is very healthy coming sick with something like COVID is almost virtually unheard of. And just because somebody's an ideal body weight, they still have to be exercising. So somebody may be lean but not exercising, that puts them at risk. So as always, I'll put a link to this particular study in the comment section. Make sure that you like this video, share it with somebody who you think needs the information, and subscribe to the channel.